The number one thing for infection, a total buzzkill, if you will, for infection is smoking. So if you're a smoker, the best thing you can do to help fight an infection or to heal your fracture, even if it's not infected, is to stop smoking, because smoking it's a double whammy. You have the effect of carbon monoxide, which decreases your oxygen carrying capacity. So your oxygen delivery to the tissue, and thus the bone, is decreased dramatically. Nicotine, which is in obviously cigarettes, is a direct poison to osteoblasts. So by smoking a cigarette, you suffocate the cells and then you poison them, so it's a 1-2 punch. The other thing that smoking does is it inhibits the formation of collagen. And collagen is like the building blocks of bone. It's like the rebar, long collagen bundles. Picture it as rebar for cement, and then the cells come along, line up on the collagen bundles, and then form bone. But the rebar has to be there, otherwise you don't form bone. So when a patient smokes, it knocks out the collagen forming cells. They don't form any collagen. So if a patient smokes a pack a day, and the only time heavy smokers aren't smoking is at night when they're sleeping. Most heavy smokers don't sleep that well because of the effect of carbon monoxide. They're always awake. So if you figure there's 24 hours in a day and you're only sleeping 4 to 6 hours, the only time you're forming really good bone is at nighttime. That's why the data is very specific that it takes 3 to 4 times longer for a smoker to heal a fracture than a non-smoker. And that's because of the carbon monoxide, the nicotine, and the collagen inhibitory effect that smoking has. So the best thing you can do to heal the fracture, the same effect holds true for infection. If you're not delivering oxygen to the tissue, you're not fighting the infection. And it also has a vasoconstrictive effect, clamps down on the blood vessels, so you're not delivering antibiotic. So it's a vascular effect too. So number one thing, don't smoke. Number two, watch your diet. A lot of fast food, high carbs, low protein, also is a buzzkill to fighting infection, also to heal your fracture. And taking your antibiotics when you're supposed to, being compliant in your treatment. But really the main thing would be avoiding noxious activity. If you're taking steroids, we try to have to cut you back on steroid medication. Diabetics, you can't really do much about. You're kind of dealt a difficult hand if you're a diabetic. Very difficult to fight infection because of the small vessel disease that diabetics have.